This screencast is about bias. The technical definition of bias is systemic error that causes incorrect estimates of association. And I'll say that again. The technical definition of bias is systemic error that causes incorrect estimates of association. And so as you remember, the idea in quantitative research is to find associations between two or more variables. So we're looking to prove or disprove that a given independent variable is impacted by a dependent variable and measure the strength of that association between the independent and the dependent variables. So when thinking about bias, it's important to keep in mind that bias is a lot more like structural or institutional racism than interpersonal racism. It's something that's built into the design of your research and that's present in the structure. So it's often, no one's fault, no one's conscious decision, but a lot of the structures that we use, the designs that we use for research, have biases built in. It's also important to note that there will never be research without bias. Bias is present in all research all the time. So that being said, it's important to be attentive to bias, to when you select a research design, to pay attention to the kind of biases that might be present, and to look to minimize bias, knowing that we will never, ever have studies with no bias at all. So two important terms related to bias are generalizability, which is also called external validity, and internal validity. So generalizability looks at whether or not the results of your study can be applied to a larger group outside of the people who are actually included in your study. So in other words, can you generalize out to the larger group from what you learned in your study? Internal validity is the opposite. It's looking at what kind of biases were present in the study. Was our study done well enough to explain our own results? Are our results meaningful based on the biases that were present in our study? So now I'd like to talk about some different types of bias, and we'll go through them one by one, including what kinds of study design or research design they're most commonly found in. Before I start talking about types of bias, though, I want to share an idea from psychology. So this is not an official type of bias at all, but there's a phenomenon within psychology called confirmation bias, which is the idea that as human beings, we want to continue believing what we already believe. In other words, we like being right. That's a characteristic of being human. And so that means that in research, like in everything else, our desire to be right, to not have our beliefs challenged, can lead to issues. So a lot of biases in research, official kinds of biases, stem from this concept of confirmation bias, or as researchers wanting to minimize challenges to our pre-existing beliefs. So with that in mind, I'd like to talk about some specific kind of biases that can be present in research. So one is history bias, and history bias is often present in longitudinal designs. And this means when something happens in the middle of your study period, an unexpected world event. So a really good example of this is 9/11. So let's say that prior to 9/11, there was an ongoing longitudinal study of healthcare utilization in New York City. No one could have predicted 9/11. It was a historical event that happened, but it absolutely impacted the pattern of healthcare utilization in New York City, at least for, the first couple weeks. And so that means that some of the observations we might have seen or the data we might have collected in an unrelated study of healthcare utilization would absolutely have been impacted by the way hospitals were suddenly flooded with patients on September 11th. but it wouldn't have been because of any intervention we were doing. Healthcare costs skyrocketed, again, unrelated to many studies that were going on. So another example is, let's say I get a grant to do a year-long study to teach high school kids how to balance their checkbooks and give them some basic financial literacy skills, and then I track their spending patterns for 6 months after the classes happen to evaluate the class. And then in the middle of my study period, the zombie apocalypse comes, which changes the economy completely. So we do see a lot of differences in high school kids' spending habits. But because of history bias, or the impact that the zombie apocalypse, this external to my study event, had on the economy, we can't really say that the changes in their spending is due to my class. History bias is different from maturation bias, which is another kind of bias that's often present in longitudinal designs. And maturation bias isn't related to a specific event like history bias is. It's just the idea that by nature, human beings change and grow. That's just a condition of being human. We're constantly changing and growing. So if I'm measuring the relationship between eating broccoli and growing taller, maturation bias might be at play, in that maybe children grew because they ate broccoli, but maybe they just got taller because that's what kids do. And it's important to note that maturation bias is often present in longitudinal studies of children, but it's not limited to children. Adults are also changing and growing. So maturation bias and history bias are two kinds of biases that can be present in longitudinal designs. A kind of bias that can be present in both longitudinal and cross-sectional research designs is recall bias. And recall bias happens when you have two or more groups, but there's a categorical difference between groups that impacts how well members of each group remember things. So, as you recall, in quasi-experimental and experimental research designs, you are comparing two or more groups. However, if there's something different about the groups that's unrelated to the outcome being studied that might make them remember something differently, recall bias might be at play. So an example of this is if you are looking at a particular kind of medical treatment, let's say for preventing diabetes. And so you had a control group of people who were not at risk for diabetes. And you had an intervention group that included people who were at risk for diabetes, and you were testing the efficacy of diet counseling in preventing diabetes. If there was something about having diabetes or being pre-diabetic and being prone to low blood sugar, which impacts people's memories, you would have recall bias at play. Because if you gave the same, let's say you gave the same nutritional counseling lecture to people in both groups and asked them some questions later on, if one group was at risk for having low blood sugar, which impacts their ability to remember things, the results might be biased, in that the information you get about the efficacy of your nutritional counseling class would be colored by the fact that people in each group are remembering things differently. Another kind of bias that's often present in non-randomized sampling designs is selection bias. And selection bias refers to the idea that the people who end up being in the study, who select to be in the study, might be categorically different from the people who aren't included in the study. So an example of this is if I wanted to study access barriers to contraception, and I decided to do a survey of people who were waiting in doctors' offices, selection bias might be at play because there might be some real categorical differences in contraception access between people who have access to a doctor in the first place and people who don't. So the people selected for my study who are waiting in a doctor's office probably won't be representative of the entire population of people. So my results might not apply, and I might miss important things by selecting only people who are already in a doctor's office. Another kind of bias that can be present in longitudinal designs that collect data or survey people over time at two or more different points in time is testing bias. And this is the idea that people in general, we get better at taking a test or doing a task the more times we do it. So if you've ever, retaken your SAT, you did better the second time around. Maybe not because you got smarter, but because you'd already taken the test once, and so you did better. Testing bias relates to, but is different from, instrumentation bias. So instrumentation bias is when the instrument or tool or survey you're using to collect data changes over time. So this can be something like in the second round of collecting data, you realize that the way you worded a question was confusing for people, so you change it the second time around. Or you have a new researcher collecting data, or you're in a different environment. So an example could be if you have first grade children take a test sitting at desks in a classroom, and then you have them take the same test again in second grade to evaluate whether an intervention you did increased their knowledge. Maturation bias would be at play. The children are older now. But instrumentation bias might be at play too if instead of sitting at desks, they're now taking this survey in the cafeteria, or the environment is different and the person administering the test is different too. Another related kind of bias is called interviewer bias. And so this can happen when the interviewer, the researcher, the person collecting data, knows whether participants are in the control group or the intervention group and allows their own bias to seep in. So by knowing which group the participant is in, the researcher has the opportunity to subconsciously influence the outcome by asking things slightly differently, by allowing more time, by coding things differently, by allowing their personal prejudice or desire to get a certain kind of result to seep in. The way to protect against interviewer bias is to have the interviewer be what's called blinded, which means the interviewer is unaware of which group the participant is in. So the researcher finds out at the very end of the study, after all the data analysis is complete, if they find out at all which group any given participant was assigned to. This isn't always practical or feasible. There's definitely some situations where the researcher can't be blinded. Related to that is what's called observation bias or misclassification bias, and it's sometimes also called information bias. I'll call it misclassification bias for the rest of this slide. So misclassification bias has to do with documentation of which group any given participant is in, the intervention group or the control group. And so in any kind of situation, it's possible that someone would get misclassified. So I, for example, accidentally write down that a participant has a diagnosis of diabetes when they in fact don't. And if that happens to members of each group at the same rate, it's not really, it's called random misclassification bias, and it doesn't need as much attention. What does need more attention is what's called non-random misclassification bias. So that's when there's something about one group that leads to more misclassification than in the other group. So an example of this is a few years ago, I was working on a quantitative study of whether people with intellectual disabilities get the same kind of primary care as people who don't have intellectual disabilities. So we had several indicators, which were things like getting a flu shot, getting referred for age-appropriate cancer screenings, things like that. And we were using medical records to obtain this information. The thing, though, is that medical records for people with intellectual disabilities, the medical code that indicates that they have an intellectual disability isn't always entered in to the notes for the visit, which is what we were looking at in this case. So in other words, if a person with an intellectual disability goes to the doctor because they have a sore throat or a urinary tract infection or something else entirely unrelated to the fact of their intellectual disability, the doctor often doesn't write down intellectual disability. They just write down sore throat, UTI. And so that leads to misclassification when we were looking through the visit notes in these medical charts, meaning that people who had intellectual disabilities were much more likely to be misclassified as not having an intellectual disability. It's almost unheard of that someone who didn't have an intellectual disability, a doctor would write down that they did and be wrong about it. That rarely happens. So people who had intellectual disabilities were much more likely to be misclassified than people who didn't. That's an example of non-random misclassification bias. Another kind of bias that can be present in longitudinal studies is called regression to the mean. The mean means the average. So this is saying that the human tendency over time is to get closer to the average, even if at one point you had been on the extremes. So that happens both, emotionally and with our beliefs that if you interview me today, I might have extreme views on the topic, but over time, my views are likely to become less extreme, and that's just a human tendency. This is also true on a biological level, that people who have, for example, very, very high blood pressure either pass away from this condition, have negative health consequences that lead to their death, and so they wouldn't be counted in the next sample, in the next data collection period, or their blood pressure gets back under control and becomes lower. And, the same thing is true of many biological things that are documented. So regression to the mean is a kind of bias that you see more often in biological studies as opposed to social science research. Related to that is this concept, or this bias of loss to follow-up, sometimes also called mortality bias. And this is present in longitudinal designs where we're collecting data over a time period. We're collecting data at 2 or more points. And so in general, whenever we're doing a study that goes on for a while, people will move, people will change phone numbers and forget to give us their new number. They'll pass away, they'll lose interest in responding to study questions. And if it's the same across groups, if the same number of people become lost to follow-up, which means we can't get a hold of them to collect their data at the next data collection time, that's just noted as it isn't really a bias. However, if one group is much more likely to experience loss to follow-up, this introduces bias. So for example, if we were doing a study comparing individuals experiencing homelessness to people who are housed, we would have much more loss to follow up in the homeless group, perhaps, as people who are experiencing homelessness are more likely to change their phone numbers or otherwise not continue to participate in the study. Another kind of bias in research designs that compare 2 or more groups to each other. So as you recall, this is in quasi-experimental and experimental research designs. We're comparing a control group and an intervention group, or we're comparing 2 or more groups. However, if people who are assigned to different groups have contact with each other or live in the same neighborhoods or communities, they can share information and ideas. So an example of this is when I was working on a quasi-experimental study where we were having people either get some educational material or just be in a control group where they got where they watched a different kind of video that wasn't educational. And after a while, we asked them all how much they knew. So we were originally going to every participant, after getting some basic demographic information, we were going to flip a coin to assign her to the group that got the educational content, or the group that didn't get the educational content. And then we realized that many participants either lived together in group homes or received services from the same agency or were members of the same social club. So it was entirely possible that someone who had been assigned to the group that got the educational intervention would run into a friend at a social event and tell her about the information, which would then impact the friend's score on the next data collection point. It would seem that the friend had learned more than had more of the information than she would have if she hadn't have spoken with the other participant. So we learned that in order to prevent diffusion of treatment, we had to randomize people not at the individual level, but everyone who lived in a group home would be assigned to either the control group or the intervention group, and everyone who was a member of one social club would be assigned to the same group to prevent diffusion of treatment. And finally, the last kind of bias I'm going to talk about is confounding factors. So a confounding factor is defined as anything that impacts both the independent and dependent variables at the same time. In other words, confounding factors are things that muddy the waters and kind of confuse the relationship between the independent and the dependent variable. An example of a confounding factor is, let's say we were doing a study to determine the relationship between how much sleep you got, the number of hours of sleep you got, and how many times you were sick over the winter. So in that case, the independent variable would be numbers of hours of sleep you got, and the dependent variable would be how many times you called in sick to work. And our hypothesis is that the amount of sleep you get impacts your likelihood of getting sick. However, a confounding factor here could be having children, particularly young children. So if you have young children, you are probably getting less sleep. So that's impacting. So the fact of having young children who wake you up 8 times a night impacts the independent variable of how much sleep you get. And it also impacts the dependent variable of how often you have to call in sick to work, because children are cute, but they come home from school and daycare covered in germs, making you more likely to get sick. So being a parent is a confounding factor because it's impacting both the independent and the dependent variables. So in summary, there is always bias in every study. But it's very important to ask yourself when you read a study and when you're designing a study, what kind of bias might be involved here? What bias is inherent to the research design that I'm choosing or that the study authors chose? What are the strengths of this study, and do the strengths of this study make up for the bias? And what was the research question? And is the research design used appropriate to answer the research question with minimal bias? Is there a way that the research question could have been answered with less bias? And it's important, going back to the psychology concept of confirmation bias, it's important to think about what the agenda of the researcher was, as well as what your own agenda is, so that you can truly apply the study you've read to evidence-based practice as a process, considering your clinical experience and the client's preferences and needs, as well as the research evidence.